Hey folks, Doug Blake with Body Design University. In this video, I want to talk to you a little bit about the assessment process and how NASM goes through this. And this is chapter 11. Now remember, chapter 11 begins, for the most part, those high priority chapters that you're going to need to know inside and out for the most part when it comes to the testing scenario. But as we go through the very beginning of the chapter, NASM wants you to understand the importance of assessments themselves. Now, please understand something. What they have in their textbook is a very conservative way of understanding and dealing with the assessment process, and they tell you that throughout the chapter as you're going through this. From the very beginning of this chapter, you got to keep in mind that they're going to tell you if the client doesn't necessarily want to do a particular physiological assessment, then technically, from their perspective, you might not want to do it. Some clients don't feel comfortable having you do their blood pressure, for instance, or having you take their heart rate or whatever, or body fat percentage. And so remember, that's their conservative take on it, which is absolutely fine. Now, in the real world of personal training, my clients don't have that option. I have basic assessments we're going to do. I have to know your body fat percentage. It's the only way, along with your body weight, that I can assess your total lean body mass, which I need to know. That's one of the reasons you're paying me as a trainer, is to get you the goal, get you to your goal. And if your goal is to lose body fat, I got to know how much body fat you have. Now, this then leads to the necessity, if you want to call it that, of doing any of these other physiological assessments. The recommendation, again, not necessarily from the NASM textbook, you got to know this stuff to pass their exam. But the reality is that it is a good idea to take their blood pressure. Why not? It literally takes you a minute to do it. It's not a bad idea to understand some basic components of their physiology and do some biometrics. Why? Not because you're doing anything clinical with them. When you take a client's blood pressure, you're just giving them some monitoring information, right? Um, and so you just got to keep that in mind because your clients, they should be seeing their physician for their physicals and biometric data collection that the clinician can deal with if there's problems. You taking somebody's blood pressure and it's 140 over 90 doesn't really mean much to you. You're thinking to yourself, well, the American Heart Association says that that's high. That's hypertension potentially. Well, yeah, okay. That's not that's not your issue. You simply write it down. If you do find that it is there's a discrepancy in what they normally have normally know their blood pressure to be, just as a for instance, then you make a recommendation. Remember, as a trainer, your job, in a sense, when you see issues related to biometrics, is to go ahead and tell them to go see their physician. Now, anybody, and this is why you need your CPR certification, your AED, and your adult first aid, just as for instance. You want to go through those because if you see a client that if you take blood pressure, for instance, and the client kind of face is red, they're a little kind of woozy or whatever, you take their blood pressure and it's 160 or 170 over 100 or 105, and I've seen those numbers on people. Okay, this is an obvious crisis situation that you might be seeing. But I'll be honest with you, I've had clients on blood pressure meds in the 150 over 95, 150, 145 over 100, and they're on blood pressure medications. That's kind of scary. You're not a clinician, all you're doing is giving them that information. I'm going to highly recommend, this is what you say, I highly recommend you go get this checked out. Again, like I say, NASM gives you the numbers if they are going through a hypertensive crisis. They give you those numbers where their systolic number is, in the 150s, 160s. They could be in a crisis situation, right? Be safe with it. But somebody with what we would consider to be elevated blood pressure, you're just writing that down. So the point the whole point of that explanation is that you do want to do these biometrics. Like I say, I never gave clients a choice. That's part of what you're getting when you train with me. I'm going to do that on a monthly basis. So from NASM's perspective, they do want you to know certain things. And that's what the video, I want to kind of go over this in the video, which is the first thing they want you to do is what's known as a sort of a health history. They have a Part Q questionnaire at the very beginning of the chapter. They're going to give you the standard now in the fitness industry, which is the pre-participation screening. It contains a health risk assessment, Part Q, like I just said, and is going to give you some basic information before you do any biometric testing. And so, health history questionnaire, these are all important. Read through this. Obviously, there are a number of bullet points, purpose of the assessments. It's really good to know this. Why are you doing this assessment so that you can explain it to your client if you're going to follow this scenario that NASM gives you. The health risk assessment, this questionnaire used to collect information regarding existing risk factors. You're going to generally use this so that you can tell somebody to go get a physician's release for the most part. Physical activity, readiness, the Part Q. We used to use this years ago. I don't necessarily do it any longer, but it's one of the better ones to have your client fill out for you. NASM, if you look on page 344, is giving you some clear guidelines, and they have given you two critical boxes here. Fitness professionals should continue to consult with medical professionals for any questions pertaining to disease or signs and symptoms found in their client's Part Q. Remember, personal trainers today, you're navigating a fine line between jumping into almost a clinical questioning and what you're supposed to maintain, right, scope of practice wise in just the fitness area. So if you're going to be doing some of these assessments, just realize that you may get some bizarre readings or bizarre data. Now it's your responsibility to tell this person or refer that individual, your client, back to their care provider, right? Their primary care doc or whoever they're using. There's another critical box there on 344. Part Q, health history questionnaire is always a good idea to ask. So it's going to ask age, gender, height, weight, physician's name, contact information, emergency contact information. And now on page 346, you're going to move into perhaps important data, perhaps not so much. And this is where some folks might be a little, iffy as to dealing and answering your questions. What are your lifestyle habits? It's none of your business, right? Do I need to really tell you about sleep and stress? Well, this is a basic sort of clinical way of dealing with trying to understand where a person's base level of wellness and fitness is at. So if you're only sleeping 4 hours a night, 3 hours a night, that could be a serious problem. Well, it could be. It is a serious problem. That's just not, humans don't live on 4 hours of sleep a night. They don't do it for long, and they don't do very well when they're sleeping that few hours per night. It's just the reality for the vast majority of the population. And so on these pages, exercise habits, dietary habits, sleep, stress. Do you really want to get into all of this? Well, NASM is saying at least here's the options, right? And then their occupation, the nature of what they do, whether the job requires extended periods of time standing, sitting, right? This is all great, interesting information if you want your client to fill it out. The point of this is to tell you that for the most part, you're simply not going, it's not in the real world, you're not going to need to ask all this information. Believe it or not, you're going to talk to them about this once they've started training with you. The recommendation is to learn the material, right? Study it. I've had folks ask me this question: you want me just to study it and then forget about it after I pass the exam? And my answer is, yeah, that's exactly what I'm telling you to do. Pass the exam. Is there good information that you can use when you're actually training people? Absolutely. But you don't need to memorize all this. You have it right there in your book. or you can have a fitness assessment, and NASM gives you those. So this area right here, understanding it, knowing it well enough to pass the exam, that is your main goal. Once you start training people, you can always refer back if you need to. And for the most part, make the decision as to whether or not you're going to move forward with all of these assessments. Again, NASM tells you may not be necessary, may not be something that you even want to do, especially if the client is a little squirrely about it. Okay, so just keep that in mind as you move through this part of the chapter. If you got any questions, leave it in the comment section below. If this was helpful, you can write that as well. As always, if you have questions, let us know so we can help and assist you in passing the exam on the first shot. Have a great week. See you next week.